Hello, I'm Michael Pierce, and this is The Human Condition. Today we're talking about microdosing supplements. Microdosing is a tool that's used by sensitive patients and sensitive people for taking any supplement or food that they're worried might give them a flare of some kind of result of like their skin reacting or their digestive system reacting. And what they'll do is they'll just take a much smaller amount of something because dose-dependent responses are a big deal in drug therapy as well as in natural foods. They're not always the case, but in many cases they can be a factor. The problem is even illustrated in homeopathic medicine. Homeopaths use dilutions that are different dilutions and succussions. The herbalists also use doses that are lower or higher, and even doctors that prescribe drugs and medications that are controlled use different doses for people for a reason. So microdosing can help a lot. We hear a lot about it today with regard to mushrooms and with regard to psilocybin and other types of psychedelics, but I'm talking about just your everyday supplements that you're not sure you might tolerate. And also a person might have symptoms and they're not sure if their supplements are causing them. If that's the case, they can back off, certainly get off of the supplement, let it clear out of their body for a week or two, and then restart the supplement as a microdose. As you know, if you listen to this channel, I see some pretty difficult presentations, not difficult patients, but difficult presentations. And what happens with people is they want to try something new, and they often discover that if they start a new supplement, they crash themselves. They give themselves a skin breakout, they give themselves depression or anxiety, they have sleep disorders, digestive complaints, or some other problem. So I often tell patients to start any new product or new food in a microdose. So when we talk about microdoses, we're talking about, if it relates to the RDA, less than 10% of what a typical dose might be. So we might have a person that might have a supplement that's in a capsule, and the label directions on the label say to take 2 or 3 capsules at a time, 1 or 2 or 3 capsules at a time. So we might take a single capsule or a single tablet and break it open. We might take the capsule and pull it apart and put it on a cutting board, and we might divide it into 4 equal parts or 5 equal parts or 6 equal parts and use those parts. Just use a standard kitchen knife or a razor blade and divide them into different parts and consider using that. The utility of doing this is the ability to measure how much of a capsule or a tablet that you use. If it's a tablet, you may have to crush it up with a spoon or a pill crusher. You can get pill crushers and pill cutters for only a few dollars at most pharmacies. You can also crush them with a spoon on a cutting board or 2 spoons. And when you've got that, you have the ability not only to take a smaller dose, or a smaller serving size, as I should say, because it's not a drug, a smaller serving size of the supplement, and then you can spread it out during the day. So you might have a small, tiny microdose in the morning, maybe one at lunch, maybe one later on. You can microdose things every 2 hours or every 3 hours or once a day. But this is a very useful tool for people that don't tolerate things very well. You can also do an even more aggressive, less aggressive microdose where you take a pinch of something. You take a pill or a capsule, you break it open, you split it apart, and you've got a pile of it laying on your cutting board, and you just take the very smallest pinch that you can make. That's another useful tool for people that have some real problems, and it's worked for a lot of people. Then you can increase the frequency, you can increase your serving size every day as you tolerate it, or every couple days as you tolerate it, and you can find your toleration dose. There are often times when a person can't tolerate at a certain level, and then they can for a while, and then they can tolerate a higher dose or a higher serving size. So that process can often take between a couple days and a few weeks to build up to what we would call a therapeutic dose, which is where you notice a difference. And then once you're at the point where you've gone from a microdose, which is a dose of tolerant versus intolerant, to effective versus ineffective, then you want to go up to optimal. And optimal is where you work your way up slowly to the amount where you don't get any more improvement with higher doses. So you've got those 3 levels to play with. First is, what is your tolerance? And then what is your effective dose? And then what is your optimal or maximal dose, where you can get the most bang for your buck? Because some products you can take a whole lot of and you get a lot of benefit, and it's proportional to the dose. Other things aren't so proportional to the dose. And then some people, probably the most difficult, are the autoimmune patients. Those are the ones who, even a trace of anything that triggers their immune system, they could be sick for months. They could be sick for 30 days to months. And that's because IgG hangs around for 6 months after an exposure. So a person might try something, they might use a supplement or a food and try it, and it flares them. And then unfortunately, what they have to do is stop the product, and then they need to wait 6 months for that antibody production to come down. So with microdosing, there's a useful utility for measuring blood tests in between. You can simply measure your symptoms, and sometimes it's just each day you tolerate a little more and you tolerate a little more. So for most people, microdosing might last a few days, but for the very ill, microdosing might take months to try to figure out what works. Microdosing is quite easy, and I hope that helps you.